At the time during the pandemic, everyone was restricted to stay at home. A lot of people were forced to get out of work.
There is always a potential risk for a new threat, for a new variant, or a more lethal variant of concern.
The first COVID-19 case in the Philippines was reported in January of 2020. Shortly after that, the whole country was under strict quarantine restrictions. It was an unprecedented time for all of us. Eventually, vaccines were developed and distributed. And though new variants came in, boosters were also made available. I'm Dr. Freddy Gomez, and join us as we take a look back and assess where we are now living with COVID-19. Welcome to MedTalk Health Talk. The COVID-19 pandemic has affected so many lives. Now, joining me in this discussion, we have with us Dr. Paulo Garcia, who is an infectious disease specialist from the University of Santo Tomas Hospital. And we're also joined by Dr. Carmina Fuentebella, who is a nephrologist also from the USC Hospital and is also a COVID-19 survivor. Actually, COVID-19 during the earlier days, if I'm not mistaken, yes. Carmina. Now, let's start the discussion first by establishing what it was like back then. I'll start with you, Paulo. Take us back to January of 2020 when the country first discovered its first COVID-19 case. Bago pa lang ito noon. What was it like back then?
Well, it's a little bit difficult because primarily our first suspected case of COVID-19 was dated back around mid of January. So during that time, we still have a lack of testing capacity to confirm if it's really a COVID-19. And it was only around January 30, wherein the RITM already established a confirmatory testing center for COVID-19 cases.
How has it evolved since then, Paulo? How has the COVID-19 evolved since January of 2020 until now?
Well, from different aspects, it has evolved a lot, no? So in terms of the healthcare system, the different policies, so way back before, we are still waiting for a COVID-19 RT-PCR negative test before we set the patient as a recovered case. But right now, we are just focusing more on the symptom-based strategy. And then at the same time, the different diagnostics have improved a lot, no? And then from a single diagnostic center, now we do have numerous molecular testing laboratories when it comes to treatment management. So before, we're just using different repurposed drugs, hydroxychloroquine, until it evolved to using remdesivir in different oral medications.
I think a good question to ask, how has this COVID-19 pandemic, because it has shown so many challenges over actually a relatively short amount of time, 2 or 3 years. How has it impacted the Filipinos kaya? This question is for both of you. I'll start with Carmina.
I think it has impacted most people in the sense that a lot of us love to go out. We love hanging out with people. At the time during the pandemic, everyone was restricted to stay at home. A lot of people were forced to get out of work. We have lost a lot of people and a lot of opportunities in that sense.
Okay. How about you, Paulo?
Yeah, from different aspects, it has a significant impact. Primarily, one, in the healthcare system, the access and delivery to those patients who requires a specialist care had a significant impact. For those who will be needing hemodialysis, chemotherapy, or for those HIV patients and TB patients, they still have to wait for an RT-PCR result, or most of the services are focused on the COVID-19 cases than those cases that needs an other non-COVID urgent care. And economic burden also among those different families who have lost their jobs, as what Min has previously mentioned. And also from the societal impact. We've been seeing cases of suffering from different mental health, stress, and anxiety for the past 3 years.
That's right. So a lot of these things really impacted every Filipino in so many different ways, as well as losing loved ones, as well as something that we have to keep note of. Now, Carmina, you were one of the first people actually, or during the early start of the pandemic, naapektuhan ka, na-infect ka with COVID-19. Take us back to when you were infected the first time. What was it like back then? Meron na bang mga vaccines noon? Vaccinated ka ba noon when you were infected?
Unfortunately, during that time, there weren't available vaccines. All of us were also not aware of the proper management on how to treat COVID, how to diagnose COVID. We did not have a lot of testing done. So the spread of the virus was very rapid.
Was there any fear in your mind, in your heart? Were there any doubts of this virus, which a lot of the physicians really had little to go on?
You know, I'm a young doctor. I'm a relatively healthy person. I'm well aware that COVID mostly affects those with comorbidity. So I was not scared. I know how the disease can progress and how a person may eventually recover. I was brave enough to fight through the COVID pandemic. At first, I thought it would be easy. You know, when you get sick, I got fever. I remembered contracting it from a patient, knowing that I'm a doctor. So yes, I think I'm having COVID since I have fever, I have cough. I immediately went to the hospital. I was treated. They started me on antibiotics. And Dr. Garcia was the person who saw me when I was starting to have difficulty of breathing at the room.
Okay.
I thought it was gonna be easy, but unfortunately, things don't go as planned.
So umabot ka actually sa critical phase of the disease, where you were intubated, you were on a ventilator as well to help you breathe. It really progressed into those symptoms. Now, Doc Paulo, during that time, was the treatment of someone like Carmina, who had little information to go from, given antibiotics, like what you said, which is some of the standard protocols for something you don't really know about, was it typical what the symptoms that Carmina was exhibiting?
At first, yes. Well, in that particular case, she still tested negative for COVID. So during that time, despite the fact that she is RT-PCR negative, she's highly probable of having a COVID-19. So regardless of her presentation, regardless of the tests, we still treated her as a case of COVID-19. And then all of the resources that we can give to her, we provided her the high-flow nasal cannula and then the mechanical ventilation, to the point that she received convalescent plasma at that time. So that was the time wherein convalescent plasma was still on hype, no? And at the same time, giving different repurpose medications.
So in short, everything that was available, binigay nyo na kay Carmina at that time because things were progressing. Now we'll talk a little bit more about that, especially how it is now. Facing COVID-19 is no easy feat. Now we'll know more about how we are coping with this virus. So stay with us here on Med Talk, Health Talk. The COVID-19 pandemic posed not just a threat to public health here, but around the world. Now, still with us are Dr. Paulo Garcia, who is an infectious disease specialist at the UST Hospital, and Dr. Carmina Fuentebella, who is a COVID-19 survivor and nephrologist also from the UST Hospital. Now, continuing on with the discussion, earlier you mentioned about your experience. How long was your total stay in the hospital, doon sa ICU?
At the ICU, I was there for about 10 days. And it took about 14 days for me to complete all the antibiotics. And then the rest of the months of my stay, I was waiting for a negative swab.
Doc Paulo, during this time also, people now can get tests really quickly, within hours. But during that time, back then, it took way longer just to even get, know if you were positive for COVID.
Yes, the turnaround time for the RT-PCR is around, sometimes it's around 5 days, and most of the time, minsan umaabot pa na a week, and yung mga patient talagang they need a negative test result.
Right.
So talagang ang tagal nilang nasa hospital lamang just to wait for the result.
5 days, especially in an ICU setting, is like an eternity.
Yeah.
That's a long time. That's a long time. Now, Carmina, how has your life been since that period where you had COVID-19 and you got through it? You got well from it.
I got well from it, from the help of everyone who prayed for me. Unfortunately, things didn't go as planned. I underwent depression during that time. Since I wasn't able to cope up with everything that happened to me, I lost a loved one from COVID. I had to leave for 2 months from work since I had easy fatigability. Even a few steps, I would get tired. So it took a while for me to absorb all of that negative things happening to me.
Okay. Now, Doc Paolo, since then, since back when COVID-19 first hit us, marami ng different variants ang lumabas. How are we coping up with this? What can we expect? Can we expect a time like when Carmina, back in January, February of 2020, pwede bang mangyari ang ganong situation sa Pilipinas ulit?
We do experience different surges from different variants already. The currently predominating variant as of now is the Omicron with the different sublineages. No? So, well, it's a different situation right now. No, there are already advances in terms of diagnostics and management. We have a favorable vaccine coverage, and at the same time, the hybrid immunity. So we cannot simply say that we're completely safe already. There is always a potential risk for a new threat, for a new variant, or a more lethal variant of concern. In terms of the scenario from the previous scenarios that we had before, it is somehow less, or the possibility of a COVID-19 surge probably may be already diminished compared from the
Okay, but in
past.
terms of treatment, in terms of medication, doctors now, especially in the ICU, are more prepared. They're more.
Yes.
There's now a protocol set, on how to treat people with COVID-19. Now, how important was your support group? Do you think, Carmina, during that time?
Amazingly, I had a really big support group. I had random people from all around the world, all around the Philippines who were texting. I think support groups are important since you're in this really negative hole na feeling mo, iniwan ka ni Lord, iniwan ka ng lahat ng tao. Kasi sa ICU, wala ka namang kasama. Mag-isa ka lang doon, kausap mo yung dingding, nakatsyug ka. Yun, with the help of support, sila Dr. Rico Pao, sila Doktora, lahat sila kinakausap nila ako na, Mina, hanggat hindi kami sumusuko sa'yo, hindi ka pwedeng sumuko. So eventually, I had this positive mindset na gagaling din ako.
Okay, that's good, and I think that's really important to have that positive mindset, as you said, and that support group is really essential. Now, Doc Paolo, I'd like to ask you something about how society thinks in general, because back then, it was mixed in society. Some people were really afraid to the point of, may mga doomsday mentality na sila. They would go to the extreme. Some people were really lax. They thought it was not real. It was something that would just blow over in a few months or whatnot. As an infectious disease specialist, what's your advice for people in general? Because sometimes COVID-19 is difficult to understand, especially for someone who has still never contracted it, never been infected by it. What advice can you say in terms of safety on how they should, think about their safety?
Parang wag mo lang isipin yung sarili mo, no? But also those important persons surrounding you, no? So I think it will give them a motivation to make the necessary precautions, no? COVID-19 threats is still there, the virus is still lingering, and then at the same time, kung inaiisip mo yon, no, mas magiging prepared ka, isipin mo lahat ng safety precautions, you would still continue doing the necessary public health measures, mask up, hand hygiene, and then isolation if you already develop different symptoms.
Applicable pa ba, Doc Paolo, ang hand washing? It sounds so simple.
Yes, oo.
Hand washing, everybody, sometimes people are lazy to do it, some people still do it. Is it still effective?
Maganda ang hand washing, and then at the same time, pati yung alcohol-based rubbing, no? And then masking would really help you, no, to prevent any infection.
So kahit na optional na ngayon ang masking,
Yes, we still encourage them to at least do masking.
Okay. Now, despite the easing restrictions, we still need to take precautions against COVID-19. Now, more on this when we return, especially on how vaccines and boosters are significant nowadays. So keep it here on Med Talk, Health Talk. Since the first COVID-19 outbreak, health experts around the world worked tirelessly to come up with vaccines. Now, a great line of defense against not just this virus, but any virus. Now, let's talk about that. And welcome back Dr. Paulo Garcia, who's an infectious disease specialist at the UST Hospital, and also Dr. Carmina Fuentebella, who is a COVID-19 survivor and also a nephrologist from the UST Hospital. Now, Doc Paulo, let's talk about vaccines. Are vaccines still effective? Are boosters still needed?
Yes, vaccines are still effective. No? It would significantly decrease the chance na magkaroon ng severe diseases. The hospitalization may be also further decreases, and the mortality. No? And at the same time, while waiting for a newer generation, second generation vaccine, I think we still need to further encourage our Filipino citizen to still do the vaccination or do their shots for booster. No?
Okay. So, Doc Paulo, in terms of ma-overdose, because yun yung fear ng maraming tao, ma-overdose sa booster, highly unlikely, pero hindi rin dapat tuloy-tuloy pa rin. Ano? Kumbaga, walang direksyon, walang guidance, pagkuha ng booster. What can you say about that?
I think it would be better that we follow the recommendations. When will be the perfect timing for the booster shots? And then there are recommendatory body, no, na nagsasabi talaga when will be the best time or the optimal time, no? Kasi merong may mga shorter interval, agad nagpapa-booster shots na. So yung immunity, no, parang nagre-render ng less protection siya. And at the same time, for those who have a numerous, parang pabakuna sila ng pabakuna, although minimal, ano, there are certain risks din, ano, for those who patients or those individuals who wanted to have a more frequent vaccination.
Okay, now when it comes to those naman who feel that the vaccines and the boosters aren't for them, we have to respect those decisions as well. But what kind of advice can you give for those who feel that these are not for them?
I think it's common. Some of my dialysis patients also, ayaw nila magpa-vaccine kasi feeling nila mas may mangyayari sa kanila or may mga side effect na feeling nilang mas maaga silang mamamatay. You cannot really blame them and you cannot force them to undergo a procedure na hindi sila comfortable. Basta naiintindihan nila na yung risks of acquiring severe disease mas malala pag na-contract nila, especially immunocompromised sila. So basta they understand the risk and they're willing to take extra precaution na para hindi nila makuha yung disease na yun.
Now, Doc Paulo, right now, we live in the so-called new normal. How can people still live comfortably pre-COVID images of their lives, but still be safe from the potential of being infected with COVID-19?
I think we do have the basic tools, established basic tools already on hand. We just have to follow those tools, you know, to halter or to curtail the transmission of the COVID-19 and prevent any other emergence of a new variants. You know? So again, if possible, decrease the social mobilization, you know? So improve the ventilation, you know? And at the same time, hand washing, you know? Alcohol. And if you are having symptoms already, it would be better to have a test and at the same time isolate, you know, or quarantine yourselves. And the best time to do the vaccination and booster shots. I think it would be better if we remain vigilant regarding the current situation right now. I think it would still be best, no, if we further encourage our patients, ano, or mga kakilala natin to mask up, no, continue the mask mandate, and at the same time, if wala pa silang booster shot, magpa-booster shot. Well, we're still waiting for the bivalent vaccines, bivalent booster vaccines, no. So, and the precautions, all those necessary precautions, I think that would be a perfect ingredient for us to have a safer culture in the living the new normal.
Now, before we go, let's sort of wrap up this very meaningful episode. What kind of advice can you give our viewers, Dr. Mina, especially on the side of someone who has gone through COVID, who has their own journey with COVID?
After surviving that incident, I told myself, there's life after COVID. I am able to move forward. I am now living better. I am able to look life more positively. And after that incident, I never wished myself to be sad anymore. I hope that we keep moving forward and there's a whole new world after this blizzard that we've been through.
Okay, very true. And there's no other way actually for us to go but move forward. Doc Paolo, what's your advice for our viewers?
We have several advances already, no? And we do have well-established basic tools right now in preventing this COVID-19. We have faced a lot of challenges already. So let's learn from the past, no? And utilize it for a common good, no? Para tuloy-tuloy yung progress natin living through with this virus.
Okay, so thank you very much for those very meaningful advice for our viewers. And thank you very much, Doc Paolo, for your expertise and being a frontliner, being there for a lot of our Filipinos. And of course, thank you also, Dr. Carmina, for being with us and sharing your story and relating to us, your journey with that of COVID-19. So thank you very much. The COVID-19 pandemic has affected several lives, but together we can learn to navigate this new normal. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.